Okay, so let's get started. So good afternoon, everyone. Thank you for attending our webinar today. Just a few housekeeping comments. So this webinar will be recorded. Your microphone and camera will be turned off for the duration of the webinar. And to ensure accessibility, live captions can be enabled from the control panel. So my name is Carlene Stobie, and I'm a knowledge translation specialist with the National Collaborating Center for Methods and Tools, and I will be your facilitator today with Alana Miller, who will be our support. So we have a wonderful panel discussion today with students and recent graduates who will be providing information on resources to prepare you for your public health career. Our panelists will be Nayab Choudhury, Caitlin Ford, Aisha Taswar, and Farnaz Azarmaji, with Susan Snelling leading our discussion. So before we begin, I have our land acknowledgement and a few housekeeping comments. The NCCMT is hosted at McMaster University in Hamilton, Ontario, which is located on the traditional territories of the Mississauga and Haudenosaunee Nation, and within the lands protected with Dishes One Spoon Wampum Agreement. So a few housekeeping comments to remember. It is best to use a wired internet connection if possible. If it's best to use the latest version of Google Chrome or Firefox. And if you're having any technical difficulties, please send a private message to Alana Miller, NCCMT, and we'll be able to respond to those requests. Live closed captions has been enabled for this webinar. If you have any questions for the presenters throughout the webinar, please send them to the Q&A, and we'll make sure to get to those at the end of the webinar. And there will be a few polling questions that will pop up, so please take a second to respond to those questions. After today, the webinar and slides will be posted, so you can see the recording of the webinar on our YouTube account and the slides in English and French on our SlideShare account. Keep an eye out at our Twitter for @NCCMT, which will show you when these are posted. So our agenda for today, so first we will introduce us, NCCMT, and the other NCCs. Then we will discuss what is evidence-informed decision-making, and then we will get the students' perspective on resources to support evidence-informed practice, and then we will have our Q&A discussion. So the learning objectives for today, we will be able to articulate the key features of a model for evidence-informed decision-making and a process for evidence-informed public health. Then you will get to know our different tools and resources that our students have found helpful in public health to help them use best available research evidence and decision-making. And lastly, to appreciate the perspectives of a current and recent public health graduate students' value of evidence-informed practice and the tools they have found helpful.
Arlene, sorry to interrupt you. The slides are kind of glitching. Can you maybe try stopping sharing and then share again?
Yeah, for sure. How is that?
I think they're okay.
Yeah. Okay. It's weird, but let me know if it still glitches. It's clear on my end, so yeah, just let me know. So right now we have our pre-webinar polling question. So Alana, if you can launch our poll, and just a few questions asking who's joining us today and if you've ever used our resources before. So I'll give everyone a moment to look at that. We'll give everyone a few more seconds just to get those last minute answers in. Slides are still okay. Just going to do our introduction for the NCCs now. So the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers across Canada. We are hosted at McMaster University in Hamilton, Ontario, and our goal is to support public health professionals and organizations integrate evidence-informed decision-making into our work. The National Collaborating Centers are funded by the Public Health.
Sorry to interrupt again. The slides are glitching again.
If someone else is maybe able to share, then it looks fine on my end. I don't know why they're glitching.
Okay. Let me try. So Carlene, you just go ahead. You can do the everyone picture the map of Canada in your mind. And if you don't know what it looks like, Google it. But we'll get the image up and Carlene could just go through the promo. Hold on one sec.
Yep, I'll finish up here. So the National Collaborating Centers are funded by the Public Health Agency of Canada. So we each focus on a different priority public health topic. From the west, there is the National Collaborating Center for Indigenous Health in Prince George, British Columbia, the National Collaborating Center for Environmental Health in Vancouver, British Columbia, the National Collaborating Center for Infectious Disease in Winnipeg, Manitoba. The National Collaborating Center for Health Public Policy in Montreal, Quebec, and lastly, the National Collaborating Center for Determinants of Health in Antigonish, Nova Scotia. So with that, Susan, I will be handing it over to you to talk about what is evidence-informed decision-making.
Okay, that's good. How are we doing for slides now? Are we good?
Yes, they just show the speaker notes.
Okay. Well,
Susan, if you go to presenter view,
yep.
so have that, and then when you share slides, it's going to give you 2 options, one with the notes and one without. So the audience will see just it without the notes, but you will see with the notes.
Okay.
I don't know if it helps if maybe I try sharing mine again and it stops glitching. I don't know.
Okay. I'm just going to talk. Someone else figure out how to show slides. So welcome. I see, a lot of people are Susan Snelling. So at the end of this, I want you to reflect on how good is it to be Susan Snelling? How are you enjoying that? But first, we'll talk about evidence-informed public health, which is really what we do at NCCMT. When we talk about evidence-informed public health, what we're talking about is the process of distilling and disseminating the best available evidence from research and context and experience, and then using that evidence to inform and improve public health practice and policy. Another way of saying that is that we're about finding and using and sharing what works in public health. There's a lot of research out there that is relevant to public health that tells us about what works. And there isn't always that connection between what the research has demonstrated and what we actually do in public health. So one of the things that we really focus on at NCCMT is to be able to build those skills among people who work in public health or will be working in public health, to be able to find the relevant evidence, put it into practice, and then share that with others so that over time, our public health practice becomes more evidence-informed and produces better outcomes for the people that we're serving. So if we go to the next slide, you'll see the model that at NCCMT we call the wheel. This is the 7 stages in the process of evidence-informed public health. And you'll see the 7 steps around there. A lot of the work that we do at NCCMT is oriented to helping people to build their skills, build their understanding of what goes into each of these steps in doing evidence-informed public health. So that can include anything from define the question, first of all, being clear about what evidence you're looking for, searching, finding a good way to identify the relevant evidence, appraising the quality of that evidence, because not all evidence is created equal. Some is of better quality than others, and better quality means less bias. So we definitely want to be paying attention to the quality of the evidence we're using. Bringing it all together, sometimes what we find is just there are too many sources saying seemingly contradictory things. So we want to bring those together in a way that makes sense. Adapting to local context, which is so important for public health. Actually implementing, getting everybody on board to deliver a new program or service or intervention, and then evaluating, giving us a sense of what we're doing and how well we're doing it. Another model that we use at NCCMT, and one that I think is really helpful, is a model for evidence-informed decision-making in public health and thinking about the different types of evidence. So if we go to the next slide, we can see that there's, we call this the bubbles. So there's a bubble of research evidence, and there are lots of skills involved in finding and using research evidence. You have to be able to understand what has gone into the research and be familiar with all of the terms, the methodology. So there's a certain skill set in using that kind of evidence. But there are other kinds of evidence that are relevant to public health practice. So evidence about community health issues and local context. So sometimes this can be in terms of the burden of disease. How big a problem is X issue in the community that you're serving? Because we know that some problems are bigger in some places than in others. So if we're really trying to tailor or adapt to local context, we want to be doing that in a way that is informed about what's happening in our local communities. What are the priorities? What are the health issues? So that kind of evidence is relevant as well to being truly evidence informed. We also think about community and political preferences and actions. So what's being talked about at City Council? Is there a window right now for certain policy actions or certain kinds of issues to be addressed that maybe at another time or in another community, the community would be saying, no, not interested. We're not going to show up for whatever intervention you've got in mind. Could be a great intervention, but if nobody will participate in it just because of what's going on in your community right now, it's not the right intervention for you. So we need to have that way of finding out evidence just about our local communities, what's happening in the political sphere and so on, so that we can make most effective use of our time and effort. And finally, when we're thinking about evidence, we also want to think about public health resources. So how much money do we have to spend on public health interventions? How much time do we have, which is another really important resource? What kind of human resources do we have? So do we have people with the skills that are needed to be able to deliver certain programming? And all of those kinds of evidence together are drawn in with our public health expertise. So our sense of what's going to work for whom, in what contexts, bringing all of these sources of evidence together so that we can truly say we are taking an evidence-informed approach to our decisions. So that's by way of really quick overview of some concepts of what are we talking about when we talk about evidence-informed public health or evidence-informed decision-making. EIDM is the abbreviation we use. today, rather than me sharing any more about this, we're going to hear from some current students and some recent grads who will talk about why these concepts are important and how they've been useful in the work that they do or the studies that they have undertaken. So if we go to the next slide, we asked our recent grads and some folks who are looking forward to their graduation soon, how have evidence-informed decision-making skills been important in either your studies or your field of work in public health? And so we'll sort of hear from them, then we'll hear about why these things are important, and then we'll hear from them about the evidence-informed decision-making resources that are have been useful to them and will be available to you and perhaps will be useful to you also. So let me introduce our presenters for today, and then we'll hear from them. So I'm going to ask each one in turn to just introduce themselves, say a little bit about your educational path, other work that you've done, what you're doing for work now, just by way of introducing. So first to Nayab Chowdhury.
Thanks, Susan. I'd like to introduce myself. I'm Nayab, and currently I am a research assistant at the National Collaborating Center for Methods and Tools. And my background, I have a bachelor's of public health, and I graduated with my master's in public health from the University of Waterloo. A brief overview. So during my undergrad, I gained a lot of different experiences, specifically in health promotion and program planning. I worked with Positive Living Niagara, and their focus is supporting, educating, advocating a safe and confidential environment for HIV positive individuals and their families. I also have some background in epidemiology and health surveillance at the federal public health level. That's where I completed my master's practicum. I was working with FAC and the government of Yukon to develop a surveillance plan focused on injuries. And currently I'm a research assistant, and at my current role, I do support various different projects that are embedded in evidence-informed decision-making in public health. So my role typically supports the development of rapid reviews through various different tasks. As part of the Rapid Evidence Service, I coordinate and contribute to the development of the monthly newsletter. I prepare quality appraisals for the Health Evidence Registry. I review and update the Organizational Change Registry and conduct monthly and quarterly analytics that help us understand trends and how to improve our work and outreach. Overall, my role pretty much bridges research to practice by supporting the creation of methods and tools in order to guide EIDM.
I guess I'm next. I'm Caitlin. I recently graduated from the University of Guelph with a Master's of Science in Population Medicine, and my thesis research was on best practices for communicating about vaccines with young people. And when I was doing my degree, I worked as a research assistant as well at the NCCMT, finished in May. And since then, I've been working at an organization based in Calgary. We're a not-for-profit public health research organization called 19 to 0. So we do a lot of behavior change campaigns and program implementation in public health. And I guess previously to that, I also completed a practicum placement at the Canadian Partnership Against Cancer in Toronto.
All right, I'll go next. So hello, everyone. I am Aisha. I am currently a Master's of Public Health student at the University of Guelph, and I also completed my undergrad at the University of Guelph. I did it in biology and neuroscience. This summer, I actually completed my practicum term at the National Collaborating Center for Methods and Tools. I got to work in a lot of different areas, supporting a lot of different things that the NCCMT does. So yeah, excited to be talking to you guys today.
Okay, I think I'm next. I don't know how to change the camera to me, or is it, can you see me right now? Yeah, okay. So hi everyone, I'm Farnaz Azarmju. I did my undergrad at U of D. I did a health and disease specialist, and then I did my master's of public health at University of Guelph. So I recently graduated. Most of my undergrad was in research and anatomy and things like that, but I realized that I really like public health. So a lot of my master's work at master's was research in the area of public health. My practicums were at the NCCMT, my latest one, and also at the BCCDC. So both of BCCDC was a lot of public health surveillance and data analysis, and at the NCCMT, I was involved in a lot of projects, especially evaluation, program evaluation, and writing reports about those evaluation results. So happy to be here and to talk about EIDM.
Great. Well, thanks everybody. Sorry for the tech glitches here, but you know, it won't be the first time I think that any of us have navigated this sort of thing. So anyway, thanks for rolling with it. So, you know, fantastic group of panelists and presenters, all of whom have had an association with us at NCCMT. So we're fortunate about that. So, you know, a real breadth of experience, even for people who are at the start of their careers. So if we go to the next slide, I'll just bring up the first question that I asked each of these panelists to think about, just really to give all of us a feel for, you know, as they've started their work in public health or as they've completed their studies in public health, what does this really mean to be building evidence-informed decision-making skills, and you know, how have those skills shown up in your studies or your the work that you're doing? So we'll go in the same order. So Nayab, if you would like to jump in first.
Yeah, just to start off, I do think the EIDM skills are extremely important in public health studies and in the field as everyone gets started with their careers. So there's very different aspects it will be used. And since it's an evolving field, it helps students and professionals really just stay up to date with the latest research, best practices, and just allows for ongoing improvement in public health. So in my experience, the project I worked on for my practicum with back in the government of Yukon, it was a surveillance plan that I developed where I needed to understand the risk factors related to injuries and the ongoing priority to systematically obtain information that's timely, it's reliable, and valid in order to develop and implement different injury prevention programs and policies. So the first half was just analyzing the administrative data and identify indicators, develop methods in order to continue the injury surveillance. And the analysis portion was just strictly about the data and understanding trends and patterns. The second half of the project is where a lot of the EIDM skills I was learning in my master's really came into play. So based on the data and the analysis that was conducted, I was to create preliminary policy recommendations and future program plans. So this required me to use a lot of those skills and that I was taught and was learning through my master's. So I reviewed different public health approaches within Canada to understand what's actively being done in terms of injury prevention and what the Yukon can do to implement those strategies in some way, shape, or form into their communities. And Yukon is in the Northwest Canada, so the environment is quite different from Ontario. So having that at the back of my mind, I had to understand how to approach injury prevention initiatives. I needed to disseminate the best available evidence from research, from different practices, from different policies, and even different contexts and experiences of those living in Yukon, just to get a feel of what's out there in yeah, and just to get a feel of what's out there. So I did an informal jurisdictional scan. I did a quick overview to understand just best practices and implementation strategies, specifically in different provinces and territories regarding injuries, and use that to guide my communication plans for Yukon for any policy recommendations or program plans for the future. So regardless of where you start, I feel like EIDM really makes its way through the process somehow, and that's when I really kind of realized that it's a really critical and important skill to have.
Great, thank you. Yeah, great examples there to just see how that comes alive. Caitlin, do you want to share how EIDM skills have been important in the studies and in the work that you've done?
Yes, thanks, Susan. So as I mentioned in my intro, I'm currently working at a not-for-profit that researches and designs public health programs. And we kind of operate through a combination of grant, government, community funding, and private industry funding. So we're kind of at an intersection of academics, government, industry leaders, and then partners, as well as the public. There's a lot of different contextual factors that come into play when we're designing and researching these programs. And then so on top of that, given the limited health resources and funding, it's crucial that when we do acquire funding dollars, they're used in the most efficient way to have the biggest impact on the communities that we're serving. So when we're drafting proposals and we're following through on our funded projects, we always need to make sure that we're really rationalizing our decisions and justifying to our funders why we made the decisions we made. So when EIDM comes into play, we need to fall back on the best available evidence and research that's out there to provide that strong rationale to partners. We need to make sure that the evidence is considerate of our community's needs and our stakeholders' needs, and that they can promote the most positive outcomes with these public health programs. So we use EIDM every day when we're drafting grants, when we're following through on the programs, and the resources that NCCMT has are super helpful for that.
Great, thank you, Caitlin. Aisha, do you want to share some of how EIDM skills are emerging for you?
Yeah, I can actually provide a bit of a student perspective on this. I did mention I was lucky enough to complete my practicum here at the NCCMT over the summer. So I got to learn a lot about EIDM. I think it was more of like an introduction for me. And I think as students, most of us like to think we know what EIDM is, or at least for me, I thought when I knew what EIDM was, I was sort of breaking it down logically, thinking like evidence-informed decision-making means research, right? So I can do that. But that is an essential part of it. But there's a lot more to EIDM that you can learn. And after my practicum experience at the NCCMT, I now sort of view EIDM skills as an important bridge that helps close the dollars to policy or the dollars to practice gap. And something I would like to highlight for everyone is the NCCMT 7-step process for EIDM. Susan gave an introduction to it, just how comprehensive it is. The first 4 steps on the wheel are what most students might be familiar with, defining your research question, searching for your evidence, critically appraising it, and then synthesizing the evidence. I think some of us have varying levels of comfort with those 4, but what I'd like to bring up are the next 3 steps, which are the adaptation, implementation, and evaluation of the final decision, policy, or program. And these are the 3 factors that some public health students might be less familiar with. So I really want to underscore the importance of these for everyone who's with us today, and we'll be stepping into the field of public health, hoping to bring about some positive, tangible change. So let me put this into perspective for you. You might have come up with an excellent evidence-based program for your local community, but after you've put it into place, you sort of find that it doesn't garner any attention, or doesn't meet its intended purpose, or doesn't get to the right audience, That's where these last 3 factors come in. And the idea is sort of adapting your research to the local context so that it is relevant and suitable for the community or the intended population group. And then the next step would be implementation, which basically considers how to properly disseminate the program or intervention so that it reaches the right audience. And then the final step in the EIDM process would be evaluating the effectiveness of the implementation to sort of gauge whether you've achieved what you expected to, and then use this to use that evaluation to sort of inform future planning and then refine the existing program as well. So if you sort of put it all together, and I hope you can see how the EIDM process makes sure that the time, expertise, resources, and the effort that you put into planning your program, intervention, or policy is worth it and achieves its overall goal. So as a fellow student who has just learned about what exactly EIDM, the whole process is, it's important. I would highly actually recommend that you check out the resources that are available on the NCCMT's website. They have a pretty neat way of organizing resources so that each of the steps on the EIDM wheel has all of the resources under it. So if you're looking for resources to get started or support your work, whether it's now or later once you've graduated and are working, you should definitely use these resources to learn about any of the steps in the EIDM wheel, and then use the resources that are available for each step.
Well, thank you, Aisha. That's great. And we will be talking about those resources in some more detail. So if you're thinking, well, what resources exactly, Aisha, just wait. We're going to find out. But first, let's hear from Farnaz, your thoughts on how EIDM skills have been important for the studies and work that you've been doing.
EIDM skills have given me the ability to be able to gather and disseminate high quality evidence that's currently available in the literature, and to also use that evidence to make public health related materials such as health promotion infographics, which was a lot of the things like one of them would be infographics, other ones would be presentations to various audiences. And that's very important to use these EIDM skills to know which audiences you're working with, what kind of practices work best with what kind of audiences. And that was one area that was really helpful for me, both in my graduate studies and in all my practicum experiences. Also knowing that the evidence that I've gathered is reliable and high quality will be really important when using evidence during implementation and knowledge translation to improve public health practice and policy. And that's regardless of how small the community is that you're gathering evidence for. So for example, in my work at the BC CDC, I was involved in preparing a list of priority public health indicators and including their surveillance data on a web-based tool for population health monitoring. And so using EIDM strategies to find those priority indicators through an equity and unbiased lens was very critical to prove to senior staff at the agency and also directors that these are the indicators that the agency should focus on for the next fiscal year. So that's very important because they are looking for that EIDM skills. They are looking for what did you use to find those priority indicators, and I think that was one of the most helpful things, amongst other things.
Yeah, great, Farnaz. Thank you. And yeah, it really, so much of this does come down to making evidence-informed decisions. But another way of thinking about that is what guides the choices that we make, right? That we're going to choose one priority indicator over another based on what? That's really what it's coming down to, is making those educated choices and being able to account for, why you made the decisions that you made. So thanks for those intros. The next question that we asked our presenters is about an evidence-informed decision-making resource that they found useful, or maybe one that they wish they had known about when they were undertaking their studies or undertaking a project. Sometimes you find out about something later and you're like, oh, this could have saved me so much time. So let's let them do the work for you and save you some time if they know about things that you don't know about yet. So the first one we're going to talk about, NAAB is going to talk about the evidence-informed decision-making casebook.
Yeah, so just introducing the casebook. I am a University of Waterloo alumni, and I never really heard of any of the resources that I know now. So when I was first introduced to the casebook, it was used in coursework long before I started here, and I'm sure a lot of the ones that we will be sharing with you will be helpful. So the casebook is one that I used in my master's for a course called Research Tools for Public Health Practice. So essentially, the casebook is a collection of success stories across the country that highlight the use of evidence to inform public health practice, whether that's for programs or policies. So as a student, how this was used, I actually conducted a qualitative analysis to assess the public health programs that are listed in the casebook and develop themes in order to understand different methodological approaches that resulted in the program being successful in achieving their intended goals. So the purpose was to kind of review the full range of research designs or methods, the tools that were used in the cases, and how the use of evidence informed their decision making positively, and how it impacted their programs. So this resource facilitated my understanding of first qualitative research methods and the understanding of how important it is to incorporate EIDM in your public health programs.
Yeah, so much interesting stuff in that EIDM casebook, just from, very different contexts, but lots of good sort of examples of how this works. So thanks for sharing that one, Nayab. If we go to the next slide, the Rapid Review Guidebook, and we're going to actually hear from first Caitlin and then Aisha, who both have familiarity with this resource, maybe from a little bit different contexts or different perspectives. So Caitlin, to you first.
Thanks, Susan. Yeah, the guidebook is by far the most used resource that I turn to in my job now. So like I mentioned before, we do operate, my company that I work for does operates on partially grant funding. So there's a lot of grant writing that happens. And if anyone's written a grant before, you know that often the deadlines are very tight, but you need to kind of produce strong rationale for why you should get the funding. So we do need to write literature reviews and evidence reviews quite often. And we often follow this guidebook roadmap. So in some cases, we need to produce a literature review at the grant proposal stage, and then in some cases, we need to produce it after we've been funded at the end of the project as a final report. But in both cases, we need to be efficient with our time. So a recent example I have of using this guidebook is we are working right now with Alberta Health Services on an HPV self-sampling pilot program. So we're trying to roll this program out with Indigenous, newcomer, and rural and remote communities in Alberta, so that they can self-swab for HPV, and then it gets sent back to the lab. So it kind of reduces some barriers to getting them screened for cervical cancer. And it's really big in the news right now. I'm sure you've been hearing a lot about that. So for this review, we need to bring the pilot program out early next year. And we're right now conducting a scoping review on what practices have been done around the world for these communities, and then how we can implement them into our own pilot. So we followed the Rapid Review Guidebook model, and we produced a scoping review in a fraction of the time as a systematic review, but it's the level of evidence that we need to go forward with the program. So that is kind of my most recent experience I can share about this resource, but maybe Aisha can color in some additional details.
Yeah, thanks, Caitlin. I think Caitlin has already shed some light on how she's been using it in her workplace, but I'm quickly finding that rapid reviews have sort of emerged as a popular approach to inform time-sensitive public health decisions with synthesized evidence. I think especially after COVID, it's become pretty popular. They sort of balance the methodological rigor of systematic reviews with shorter timelines. So I guess considering the need for rapid reviews within public health, it's important to know how to conduct a high quality rapid review of evidence to sort of improve the integration of trustworthy evidence in decision making. So as part of my program requirements, I'm currently completing a rapid review, and I've been using the NCCMT's rapid review guidebook throughout. And I cannot emphasize how clearly the guidebook details and sort of takes you through each of the steps in a rapid review. It sort of provides excellent tips on how to write your final report, includes tips on structuring and content for each section. So the guidebook has been very helpful for me so far, and considering how many public health organizations have sort of adopted rapid reviews as part of their decision-making process, I think it would be helpful for us as students to keep this resource on hand, and or at least know that it's available on the NCCMT's website. So if in the future, if you're ever assigned a rapid review, you know where to find the resources.
Yeah, great. Thanks for sharing that. Really, really, I agree with you, Aisha. You know, if people weren't doing as many rapid reviews before COVID, I think it really has grown in popularity. People are just that much more attuned to the need sometimes for urgency. So it's not as if you can take, you know, 2 years to do a full systematic review. If you have a question, you have to learn how to do reviews that are still of good quality. We're not, you know, cutting corners on quality here, but doing that in a more accelerated fashion. And, you know, what compromises can you make that will still allow you to be satisfied that you're doing sort of a rigorous approach. So some great stuff there. And as we think about quality and we think about rigor, we can go to the next slide and we'll hear from Farnaz about some of the quality appraisal tools that are available out there.
First, before talking about the quality appraisal tools, I just wanted to point to the NCCMT online learning modules. Those really helped me to kind of get going. If you're very new to evidence-informed decision making, it's really good to go through the modules, even if you don't go through all of them. A few of them are very, very important, and they kind of guide you through the steps that you need to be taking in evidence-informed decision making. The NCCMT critical appraisal modules in the Learning Center were really helpful for me because depending on the type of evidence that you want to critically appraise, they look at several of those, like for example, intervention studies, systematic reviews, guidelines, whatever the evidence is that you want to critically appraise, you can use these modules to introduce yourselves to them. But in terms of the tools, the critical appraisal tools that I frequently use are those, first of all, the quality assessment tool that's provided by Health Evidence. If you go on the Health Evidence website, you see a quality assessment tool, and that kind of is a good succinct tool to it gives you an idea of how to critically appraise different sources of evidence, especially meta-analyses. That was really useful because a lot of my work was to critically appraise meta-analysis at the NCCMT, so it's a good tool. The JBI provides a lot of critical appraisal tools, and CASP, which is short for Critical Appraisal Skills Program. So that's you can go to their website, and they have lots of checklists for different types of evidence, which are very, very useful, and they'll guide you through that. So it's in a format of a checklist, which you have to go through each of them to answer yes or no, and to critically appraise them. So each of these tools systematically guides users through 3 key questions that need to be answered during critical appraisal. And that's, is the study valid? What are the results of the study? And will the results help locally? So those are the 3 critical ones. And that each of the tools will guide you through them. There are other ones that you can see here on the screen, the Agri2 instrument and the AmStar tool. So these are, there's many of them, but those are also very comprehensive and helpful.
Yeah, thanks Farnaz for sharing those. And for sure, if you have any quality appraisal tasks to do, there are tools out there, no matter what the design is, whether you're looking at a systematic review, a single study, a guideline, there are existing tools. So if you're wondering what exactly would be the right tool, there is a good collection of them on the NCCMT website. So that I would say would be your first stop. Farnaz mentioned the quality appraisal tool that's used at Health Evidence, and Nayab is going to talk a little bit more about Health Evidence as an overall resource. If you don't know about this one, that might be one to check out right away. So Nayab.
Yeah, so for health evidence, I was actually introduced to this resource when I started at NCCMT, and this is actually one resource I wish I had known when I was completing my undergrad and even my master's. It's really just tailored towards public health students, professionals, and I'm sure it'll be helpful to all of you as students through your various different projects, practicums, and even when you move along in your careers. So health evidence is essentially a database for quality rated systematic reviews that evaluate the effectiveness and cost effectiveness of public health interventions. So we search the published literature and compile public health relevant reviews, which eliminates your need to search and screen individual databases. So anything that's related, anything that's systematic review, evaluating effectiveness of public health interventions, you could search here and it'll probably be your one stop to kind of get a quick understanding of what's out there. And I know as a student, you don't have too much time to critically appraise everything when you're doing an assignment, or it would just eliminate that step for you, which I know as students, you don't have too much time on your hands anyways. So overall, health evidence can support you with finding evidence efficiently. So just accessing all the quality rated systematic reviews using the evidence. So yeah, so using the evidence and all the online tools and products that are on the website, and then just keeping up to date with the new evidence. So if you create an account on health evidence and subscribe to the monthly evidence service, each month you'll receive an email with the latest systematic reviews on topics that are relevant to you that you can subscribe to, specific to your work or your studies.
Yeah, it's a super resource. So thanks for sharing that, Nayab. And I think last week I was doing a webinar, sort of an intermediate level webinar about evidence synthesis. So going through the first four steps on the wheel. And part of what we were talking about there was just, how to do a fairly in-depth process of rapid review. And when we got to the end of it, people were saying like, it seems like a lot. I don't really have time for that, in what I'm doing. And, my response was, well, if you're really pressed for time, like someone says, find me whatever we know about X topic. If it's a public health intervention that you're looking for, your first quick stop can be health evidence, because it still covers all of those good steps in evidence-informed decision-making. You have to define the question, but actually health evidence can even help you kind of, figure out your question. It helps you with the searching because that's already kind of been done. It helps you with the appraisal because that's already been done. And it's a systematic review, so it helps you with the synthesis already. So health evidence really can help you to be effective with the time that you have to find out what works with respect to a particular topic. So it really is a fantastic resource to be aware of and to keep going back to as you have different questions. If we go to the next slide, Farnaz was already mentioning a little bit about these online learning modules, but I'll turn over to Caitlin to talk a little bit more about what's here in terms of these modules.
Thanks, Susan. Yeah, so these online learning modules, I would highly, highly recommend anyone who's studying public health right now to go onto the NCCMT website and register and complete these. They're self-paced. There's probably a dozen of them. I don't know the exact number, but they cover a bunch of different topics in evidence-informed decision-making and research synthesis. So I completed these as part of my onboarding with NCCMT, which was unfortunately for me in the second year of my master's. So I'd already been doing some research on the side And I had wished I completed these before I started writing my thesis because they were very, very helpful. So specifically the ones on quality appraisals, they helped me identify strong or weak studies, ones that I would include in my own thesis and manuscripts as I was writing them. And they really helped me become a better scientific investigator. And the principles that I learned as I completed them, I've carried them through, so that it's knowledge that I still have and use every day. So it's a relatively small time commitment if you go through and pick out the ones that you feel like align best with what you're doing right now. But the skills and the knowledge that you'll have will last long past the time commitment. So it's definitely worth checking these out. And yeah, I think that's all I have on that.
Yeah, great. Lots here for sure. So thanks for bringing those to everyone's attention. Next, we'll hear from Aisha to talk about another sort of collection or suite of resources that are available, again, through the NCCMT website, related to understanding research evidence. So Aisha, over to you.
Yeah, thank you, Susan. So the understanding research evidence videos that are available on the NCCMT's YouTube page are excellent resources for students to sort of quickly understand some of the, traditionally harder concepts in public health research and learn how to interpret them. So things such as understanding what a forest plot is telling you, or confidence intervals and standardized mean differences, and sort of understanding what these statistical measures are and what they're telling us and how do they relate to the study. So I'd say for students, this is definitely a good place to learn how to fully understand what the research is telling us. So definitely give that a try. I did watch all of them before I started my practicum here at the NCCMT, and they were super helpful. So definitely something to keep in mind for the students that are here with us today.
Great. Yeah, I still go back to these, or if I'm talking with someone about what they're seeing in a research paper or a review, and they're like, it says this was the result, but I'm not actually sure what that means, an odds ratio or something. Just sending people here, 5 minutes later, you've got the concept with some public health examples that are relevant. So it makes it really easy to understand these concepts that, maybe your stats course you thought was over and done with, but you still need to know those concepts. So this is a really practical way of being able to just refresh a little bit in the moment when you need to understand what some of the terminology means. Next, we'll have Farnaz talk about a really interesting suite of tools related to policy specifically. So we've got a couple of the titles up here, but there is a whole collection of them. So Farnaz, over to you to talk about the support tools.
Yeah, so I guess this is one resource that I really wish I had known in the first and second year of my master's, especially the second year for my public health administration course that had to do a lot with policy, and a lot of other courses also have to do with a lot of kind of looking at policies and things like that. And recommending whether we want revisions done to them or what are their impacts on public health, how can we change those impacts by changing the policy, what are the implications and things like that. And these support tools for evidence-informed health policy making, or STPs, Cochrane also suggests them for evidence-informed decision-making in policy. So these are a series of 18 published articles that are written for people that are responsible for making decisions about health policies and programs, and also for those who support these decision makers. So that would be really helpful, especially if you have any practicums where your supervisors are decision makers or they support decision makers. And so these series are intended to help ensure that decisions are well informed by the best available research evidence. So for example, number 10 here talks about how to take equity into consideration when you want to assess the findings of a systematic review, and then from those you want to either make a policy or revise one that's already been out there.
Yeah, there's really lots to learn and appreciate, I think, with these support tools. So definitely suggest that you look those up. They're in the Health Policy and Systems Journal, but you'll also find a write-up on them in the Registry of Methods and Tools, which is on the NCCMT website. So thank you to our presenters for talking about these resources and kind of giving you a flavor of why should you care? How are they useful? We do have some time for questions and discussion. So I'll invite anyone to ask a question of our presenters or ask anything about the resources that we've heard about. Or maybe you're saying, you know, okay, but is there a resource about this other thing that I hope someone has come up with? Maybe we can kind of brainstorm and point you in the right direction. So happy to hear any comments, questions, feedback, reactions to what you've heard. Yeah, just jump in. Probably chat is the easiest way to do that. And while we're thinking about that, I'm going to ask the question that I think every student or most students who are on this webinar now are thinking about. How did you get the jobs that you've had? Because you know, with this set of panelists, you know, you've really had such varied experiences. You know, lots of different settings that you've worked in. Is there anything that you would say to people who are, you know, just in their studies now or just completing their studies about you know, finding interesting work to do, or you know, what next steps might be useful just to be moving on to applying some of these skills in a public health context? I'll just open it up to any of the panelists that would like to comment on that.
I can go first, Susan. I think so. For context for the group, when I did my internship at the Canadian Partnership Against Cancer, I just applied through an online job posting. I saw, I think it was on LinkedIn. I clicked on the organization and was interested in the work they did, and then went through the interview process. So that's definitely one place to look, the LinkedIn jobs that come up, just to even give you an idea of what's out there and then what organizations are kind of in the field you're interested in. For NCCMT, it was through connections with a professor that I worked with at the University of Guelph. So again, just networking with the people you know. If they're working on something you're interested in, just reach out and chat. If you find, like if you're in an event like this and someone's talking about something you're interested in, you know, ask for their email, follow up with them, and make connections that way, because I think it sounds cliche, but it really is about who you know. And you know, paths lead to jobs, and connections lead to jobs in that way. So I think that's probably my biggest advice for students.
Yeah, I was I can go ahead. I was gonna say definitely look at what, if you don't know what you're interested in and what area you'll be best at in public health, because public health has a lot of areas and a lot of different branches. So maybe try looking at the courses that interest you the most when you take them during even undergrad or master's, and connect with the professors and instructors there, and see what research they're doing, what works they're doing in public health, and if you're passionate about it, or if you're really interested, send them a message, message on LinkedIn, and just say how interested you are and whether you have experiences in that or not, or if you're open to learning. And everyone's very nice, and everyone's wants to teach, and everyone wants everyone to grow their careers. So that was one way that I got to know about NCCMT, and I got to work with a few of my professors on their research projects, and I found out what I was really interested in, which was health promotion. So yeah, that could be one way.
Yeah, that's great advice. Anybody else want to comment on that? Sharon, I am.
Yeah, I great points by Caitlin and Farnaz. Again, connections, great way to go about finding jobs or practicum positions. That's actually how I got my practicum here. I just reached out to the NCCMT saying I was interested in the work. You know, can we talk a little bit more about this? And that's how I sort of got in here. Again, please take those chances. The worst that anyone can say is no, but then, you know, make those connections, put yourself out there. Like Farnaz mentioned, people really want to help you in this field. So definitely put yourself out there, take those risks, and it definitely leads to some good results.
Yeah, I also agree with everything the panelists have said. And I don't know if this is something that's at every school, but practicum coordinator, they're really helpful. They're there to help you too. I know that was the reason I was able to get a practicum that was tailored to what I wanted to focus on and what I wanted to focus on and what I wanted to learn in my practicum. And for me, I kind of feel like I kind of explored a lot with all the different kind of experiences I've built up until now. And that's kind of the only way you can learn what you like by doing it. So having the background in health promotion and then surveillance and epidemiology, and then now going into more of the research and evidence side, it helps you build the experience, but also understand what you like, what you're good at. And I know in like courses and stuff that you could understand through that too, but sometimes the practical experience is needed. And just building those connections, whether that's in the academic field or reaching out, like Aisha mentioned, to the organizations themselves.
And I see a question here from Srinita. How early do you have to search for these kinds of things? I mean, everything would have a different deadline, but you know, any advice that you have just in terms of the timing of when to start looking for sort of that next step?
I'd probably say, like Susan, you mentioned, there are different deadlines for every position. I think practicums have different deadlines, and I think your practicum supervisor is probably going to have the details on that. In terms of jobs, again, I think they come up on job posting boards, LinkedIn. Sometimes they come through connections. So I guess they're ongoing. People are hiring at all times. So maybe again, with like connections, if you make those connections, someone's going to let you know that there's this position that in my workplace or someone I know is hiring. You can apply to those. I don't think that there's a definitive answer to that. Like this is the time you need to start. Generally, people say the earlier the better, but sometimes those positions come at all times. So definitely keep an eye out for deadlines if there are anything like that. But if it's connections, then it's different. I'd say it's hard to give a definite answer to that.
Yeah.
I guess when I was graduating, I started kind of looking for full-time jobs. I graduated in May, and so around February, March is when I started reaching out to people in my network. So that was the timeline I kind of worked on. But I'd also say, like, I worked part-time during my master's at NCCMT. So some similar organizations might hire people to work part-time while you're in school, if that's something that you're interested in kind of gaining experience alongside your studies.
Yeah, that's a great point. Yeah.
Yes. Yeah, I
Go
just
ahead.
wanted to add, for myself, I graduated in August of 2022, and my practicum was early that year. So I started looking for practicums and applying to practicums 4 months ahead of time, and some places have a really long hiring process. So I think taking that into account if it is practicum specific, versus looking for a job after you've completed your studies, just keeping that in mind, because when I was applying for my practicum at BAC, the process took so long that I had to have started when I started in order to start my practicum semester in the winter. So just to keep that in mind as well.
Yeah, and having been on the sort of the hiring and recruiting side, I can tell you that it can take an incredibly long time just for everything to fall into place. And if you put something in and you don't hear for a long time, that doesn't necessarily mean that they've moved on to someone else. Sometimes it does. But sometimes it just means like the wheels are still in motion. And so don't be discouraged. Manasa is just asking, how do you stand out when you're applying for these jobs? And Manasa, I'll give you a hint. Maybe it's something to do with evidence-informed decision-making skills, but I'll turn that to the presenters to just see what your thoughts are about, you know, how do you stand out when there are lots of applicants for entry-level positions, and it sort of feels a little bit challenging sometimes, I'm sure.
I could maybe say a little bit about that. I think when at least when I was applying for practicums, it's like a job posting, it's like a job application. They have a job posting, you read that and you see if you meet the qualifications and you apply for it. I think one of the things was that I looked at my resume side by side to that job application, and my passions and interests, I would write them down somewhere, and then just align those with what they are looking for in the job application and see which ones I meet. And so I would highlight those in my cover letter and my email to each of these organizations or agencies. So highlighting those things that they are looking for and that you meet is very important. There's one thing to show your experiences and all your knowledge and everything, but there's another to kind of highlight the key ones that they are looking for. So I think that was one thing that would make me stand out, I think.
I think for me, a big piece of advice and one that stuck with me when I was an undergrad is that all experience is experience. So if you've done, like Susan said, the online learning modules, you can put those on your resume. That's something you can speak to in an interview or on a cover letter. If you volunteered, even if it's not directly related to the job you're applying to, if it's a unique experience and you can speak to that and kind of how you developed as a person, how you develop soft skills that would benefit the job that you're applying to, that's another thing to add. And a lot of times employers, not always, but most times employers are conscious of the fact that people coming out of school don't necessarily have a ton of job experience to speak to, and so they'll look to those experiences. I'd also say if you know or you see someone on LinkedIn, for example, who works at the organization you're applying to, you can always connect to them. And often having that initial conversation will get you through that first stage of the interview process, at least get you an interview or get your resume onto the pile for their manager to look at. So definitely just reaching out to people in the network. I found most people in public health are very nice and very willing to help. So it doesn't hurt to ask.
Yeah, great points there. And I'm just seeing some of the questions in the Q&A as well. Thanks, Michelle, for pointing me there, because those are great questions. So one of the questions is about, did any of you have mentors? How do people find networks of early and mid-career professionals to learn from and foster those connections for career growth? Did any of the panelists have what you would call a mentor or make connections other than in the ways that have already been mentioned?
I can start off. In terms of mentors, no, but the fastest way to kind of network and create those connections is with your professors, creating that relationship with them as well as your peers. When I was in my master's, not everyone was my age. There was people that were far in their career and they're doing their masters now, and so just creating those connections with your peers too, because you never know what opportunity will come along your way. And I think professors too are a very good way to kind of dive deeper in your interests. For NCCMT, I got this opportunity from a professor that worked along with our scientific director, Maureen. So I think there's a lot of value in the networks you create within your school and your academics, and it doesn't always have to be professional and in like the professional world.
Yeah, I think as a student, I can add to that, and definitely what Nayab said is completely true, that your professors are a great resource. They've been in this career for very long. They know people in this career. They know a lot of things, so definitely leverage that resource. I didn't have a mentor personally, but my professor has been my advisor for this program has been amazing in giving us some great experience, getting us in touch with a lot of great resources, connections. So, definitely leverage that resource as a student. Another thing I'd say is maybe like once you get into the field or have spoken to a few people, they are very willing to help you as well. So maybe not a definite person that's like, okay, this is my mentor, but there are people that will help you, and then you can just start building your own career from there. I think that that'd probably be my answer to that.
Susan, you're muted.
Sorry, a little frozen there. So someone else was saying, just shifting to thinking about projects and doing evidence-informed decision making, that it's important not to start at the beginning. So there are other people who have been doing this work for a while, reaching out to people, not assuming that you're the first person to ever think about this topic. There are probably others. Can any of you sort of reflect on that sort of experience of, as you've been connecting with people to, just find out about the kind of work that they do? How do you sort of build that kind of collaborative approach and reach out to networks of people that may be interested in the same things that you are? Anything else that you would add to that?
I can start. So I mentioned, and I saw another question about the HPV self-sampling pilot that my organization is working on right now. So part of that was conducting a scoping review. So we identified 27 or 26 studies that were doing similar work around the world. And I cold emailed the contact researcher on each of the papers, and we've set up calls with a bunch of people doing that work around the world. So New Zealand and Australia are big leaders in that space. We're chatting with them. We're trying not to reinvent the wheel. If they have resources that they're willing to share with us in Canada that we can use, and they've been tested and they've been kind of piloted in those populations already, we're very aware that we don't want to replicate that work and use resources and time that could be used to be piloting the program in Canada. So definitely contacts being made in my work. Susan and I, when I worked at NCCMT, also did something similar where we were conducting a project on on disease surveillance, and we contacted kind of the Public Health Agency of Canada equivalents around the world. So we got to chat with a bunch of people in different countries, which is very neat. So it's great to build your own network, and it's very cool to talk to people doing similar work.
Yes, I will build on that. From in my experience, I guess the best way to convey your research findings and any results that you have when presenting to senior decision makers or your supervisors, it's obviously the way that they are, the format that they ask. So for me, it was a lot of presentations, PowerPoint presentations with speaker notes and things like that. So you'd have to kind of it's really good practice during your master studies to kind of learn how to have develop an entire presentation of your findings, how to summarize everything into a short but also succinct presentation. That's key. because what I found was that in practicums and things like that, they're not a big fan of, you know, long slides with lots of words and things like that. So just knowing how to succinctly tell your audience what you found in your research or what you found in any other work that you did is really important. Another way is making infographics. I think that's a really important skill to have just for any practice in public health, but that's also another way to summarize all your findings in just one page, especially using illustrations and things like that.
Yeah, that's great advice. Communication is so important when we're really trying to build a good, strong public health. So I'm happy to see other questions coming through, but maybe we will just run through a couple of other resources that I just want to be sure that folks know about. One is the NCCMT Registry of Methods and Tools. This is a free online searchable collection of resources to support evidence-informed decision-making. A lot of the tools that we were talking about today are included in the registry. Some of those tools were developed by NCCMT and some of them were not. So you know, you'll find that kind of curated selection of ways of doing evidence-informed decision-making. So again, if you're thinking, oh, I've got to do something related to evidence here, I'm not really sure where to start, there's a tool for that. Probably someone else has thought of it too and has figured out some framework, some tools, some questions. So check out the Registry of Methods and Tools. The link is there under Knowledge Repositories. You'll find some good content there for sure. And also, we talked about the Rapid Review Guidebook, but if you would like to actually see some of the rapid reviews that we've done at NCCMT on a variety of topics in public health, we started out doing these during COVID. And when we were doing rapid, I mean rapid, we were turning them around in 5 days on new topics because we didn't know anything really about COVID. We don't do them quite as rapidly now, but we still have a good collection of topics related to many things in public health. And you may find them interesting from a content perspective, but you may also find them interesting from a methodology perspective. How did we find these things? How did we search? What kind of questions are important? These can be really useful, very up to date, because they've been you know, produced in the last little while. And so maybe of interest to you, certainly useful to be aware that as we do rapid reviews, they will show up on our NCCMT website. And then the next slide just invites you to share with us. So maybe you have examples of how you're doing evidence-informed decision-making. Maybe you know, you've discovered a really cool method or tool for how to incorporate evidence. We'd love to hear about it. So email us with comments about that or any questions from today, nccmt@mcmaster.ca. Ongoing, if you've got questions or need support related to how to find and use good quality evidence in your public health studies or practice, we're there for that too. So same address will work. And if you've got questions for people today, the panelists, or for me, again, just send us an email at that address. It will get to us for sure. So we certainly enjoy hearing from people who are working with the kind of content that we are wanting to share. So I think probably it's about, we've got probably another couple of questions that we can take. So I'll quickly look through the chat and the QA to see if there's anything. But in the meantime, we are looking for your feedback on the webinar. So we'll bring up the poll, and those of you who have other stuff to do, you can move on with that. I do want to give a great big thank you to all of our panelists. Really valuable to hear from your perspectives about what you have found helpful and how that fits in with the kind of work and study that you're doing now. So thank you, everybody. Yay, great job. And I'm seeing lots of thank yous in the chat and so on. So everyone really appreciated that. But there was, I think, a question as well, and the thank yous are coming in fast and furious here. So now I've lost the question. Question just about highlighting transferable skills on a resume for a thesis-based master's student who do not have practicums. I think some of you, not everything has come from practicum, but just skills that you've developed, certainly in doing your theses as well, just to to sort of describe the skills that you built doing that. Anything that any of the panelists would want to share about how to highlight those skills on a resume so that they'll pop?
I think I don't have a thesis-based master's, but before I applied to my practicum, I technically didn't have a lot of public health experience. I would say in that instance, every experience is experience. If you whatever you've done at school, count that as experience. Any of the courses, if you've done some assignments that required you to do some critical appraisal or some research work, some report writing, put that into your resume. The idea is to make yourself look like you are trainable. As a student, as someone who's entering the workforce, people value that. People are only looking for that one skill that you are trainable. So anything that you know, anything that you can do, critically appraise, write reports, conduct some basic level of research, put that down. Use everything that you have on your resume.
Yeah, that's great advice, and I can certainly speak to that as well. More on the hiring side, is we do not expect someone to come in knowing everything. It's always a team-based approach, no matter whether you're, early career, mid-career, late career, you're always drawing on the knowledge and expertise of other people around you. So nobody is expected to come in knowing it all. What we do look for, though, is people who know how to learn, right? Who know how to draw on the expertise of others, as well as finding ways to contribute. So, those are skills that are maybe a little softer, a little harder to demonstrate. But, that's really something that I would say is, is an important thing that I would test for in an interview, or when I'm looking at a resume, is does this person have an interest in building their skills and in knowing more, learning from others? That's really critical to being successful, I think. I think we're about ready to wrap up. So again, I'll just thank our tech support folks. We put you through your paces today, so thanks for that. And thanks to our panelists once again, and to all of the attendees and participants, many of whom share the same name as me, which is fantastic. Hope you had a good experience being Susan today. And now you can stop being me. I don't want to hear from any banks or anything that you've been trying to impersonate me, but hope you had a good experience coming to this webinar today. And thanks very much for taking the time to hear about the experiences of our panelists and presenters. Take care, everyone. Bye-bye.
Thank you.